So good evening everyone. So I've got to go ahead with the audio and video. So we'll start. I have been allotted 60-minute time. So today I won't be able to wait. I have a lot of questions to cover, a lot of things to discuss with you all before your exams in this 1 hour itself. Just a minute. I hope. So we'll start. So I'll be discussing some questions from last year questions, some of the controversies which were created with those questions and reading them out before your exam. Okay, most of them were previous year, some are new. Okay, the basic aim behind is to understand and clear the concepts and to make you clear with those ideas, what was there and what is the correct answer with it. Okay, so beginning with the first question, that is tip back bends is. So last year again a lot of controversy was created, tip back bends here. So in the class I told it second order in artistic positioning, so which is the correct answer. Okay, so now I'm not going to cover up what are first, second and third order bends. Okay, those of you remember very well, those of you don't, kindly go through them. They are it's a very important topic. Hardly an exam has passed on which the question has not come either in image based form or a theoretical form. So these are the first, second, third order. First order are in and out bends to compensate the buccolingual thickness of the teeth. They comprise of the lateral inset, offset and molar offset. Second order or artistic positioning bend. Okay, so they are given to correct the mesiodistal axial inclination of the teeth by cutting the slots at an angle. And third order are torquing bends. Image by based, they are represented as follows: first order, second and third. So coming back to the second order, there are many types. First, there can be long second order bends. Long किसमें होंगे? Given in extraction cases. Short second order bend given in non-extraction cases. Common sense की बात है, they become long because of the absence of the intervening premolar. Step up and step down bends known as V bends. They are given in the region of canine and premolar, both in the upper and lower arch. What's the use of this V bend? This is, please be clear, this V bend is different from the V bend of center and center V bend which we studied in the biomechanics topic. Okay, so this V bend is simply a V shaped press bend given inside the arch. The use of this V bend is to differentiate between anterior and posterior torque. Okay, the torque between the anterior teeth and the posterior teeth, and they are given between the canine and the premolar region. If there is a first premolar present or second, they are given in between that. Okay, next comes the tip bends. So these are the tip bends. They are used to tip the teeth. Okay, and lastly are the artistic positioning bends. So these same tip bends when given in the anterior teeth are known as artistic positioning bend. And tip bends are used for anchorage preparation. Why? They are used to tip the crown back. So here in this question, the most appropriate answer would be second order. Tip bends are second order bend. And second order bends are comprised of both tip bends and artistic positioning bends. Okay, I hope I am clear. Artistic positioning bend, the same tip bends when given for the anterior teeth. Okay, so anterior teeth cannot be represented by tipping back of the crown. Okay, So that's why there is no image. So the same tip bends when given the anterior teeth are known as artistic positioning bends. Next question based on the soft tissue profile line. Again a very important thing. Please again हार्डली एग्जाम एज पास्ट जिसमें इस पे इमेज बेस्ड और डायरेक्ट क्वेश्चन नहीं आए. ओके, सॉफ्ट टिश्यू लाइन फ्रॉम टिप ऑफ नोज टू चिन इज और द इमेज रिप्रेजेंट्स विच लाइन. Okay, so this is the summary of all this line. We have already discussed them in the class. S line, Z line or the profile line, E line, H line and B line. Okay, please इसको अच्छे से मगअप करके रख लेना. मोस्ट कॉमनली E और S लाइन पे बहुत बार पूछा है. H line is the second best और Z line and B line are the next second best. Okay. Okay, sorry for the interruption. Okay, so moving ahead. Next question: unilateral cleft lip and palate occurs due to. Again a very important question from cleft lip and palate. Most commonly UCLP का reason, isolated cleft palate का reason, isolated cleft rift का reason. Based on embryological point of view they have asked. Okay, so failure of lip processes lead to isolated cleft lip. Incomplete fusion of mandibular maxillary process, it never occurs. Failure of fusion of frontonasal and the maxillary process. Non-fusion of two maxillary process. Non-fusion of medial nasal process and the maxillary. Non-fusion of medial and lateral. The correct answer is medial with the maxillary process. Okay, and at what age does it occur? So 5th week of development. Next, midline cleft lip of the upper lip is extremely rare, can occur due to split within the medial nasal process. And lastly, the fusion not only affects the lip but part of the alveolar ridge as well, which contains the central and the lateral incisor. So it can lead to unilateral cleft lip of cleft of the lip and the alveolus as well. Next, cleft of the secondary palate or a cleft of the palate, which occurs due to the non-fusion of the palatine shelves. So what can happen? Either the palatine shelves do not elevate or they do not fuse. Lack of fusion or lack of elevation due to a syndrome, Pierre-Robin anomaly. What is important for you is the date. Okay, starts from 8th week, continues till 12th to 17th week of intrauterine life. Okay, here it occurs in 5th week of development. I hope I am clear until now. If anyone has any doubt या कुछ clear नहीं है, please ask in the comment section. Okay, I'm just covering what is the most common or basic thing which is asked every time in your exam. Okay, so 3 questions hardly exam be it INI NEET has passed, जिसमें इनमें से twist and turn करके they haven't asked. Okay, next another previous exam question which is a sadomasochistic habit. Yes. So again काफी controversy created हुई when the word sado was added. Okay, so masochistic or sado means both same. It's a self-injurious habit in which the patient or the child harms himself and that becomes a habit. Example is gingival stripping. So defined as a deliberate harm to one's own body without suicidal intentions are known as sadomasochistic habit. Okay, And what is frenum thrusting? Okay, so it occurs in cases when there is a high frenal attachment in cases of midline diastema cases. So what happens? The child locks his labial femur between the teeth and permit it to be positioned for several hours at stretch on the constant repetition, which can lead to the displacement of teeth even further. Okay, so you got what is frenum thrusting. Next, so this self-injurious behavior is common in the following syndrome, that is Leschnian syndrome, Cornelia de Lange syndrome, Rett syndrome, Tourette syndrome, autism, schizophrenia, Riley-Dash syndrome. Okay, so just remember these names of these syndromes as well. Okay. So frenum thrusting again. So what is frenum thrusting? So frenum thrusting is a case in which there is high frenal attachment is present between the maxillary incisors. So what the child does is he tries to pull that frenum further between the teeth, either through his tongue or through his hand, which leads to further displacement of this incisors. So this is known as frenum thrusting. Like tongue thrusting, what happens if the patient thrusts his tongue between his teeth anteriorly or laterally? In this case, the frenum is thrusted or pushed between those incisors further. So this is a frenum thrusting effect. And these are the syndromes which are commonly associated with self-injurious behavior. Okay, so just remember their names. Next, most unstable orthodontic procedure is. So this is part of the orthognathic surgery question: widening, protrusion, advancement, or superior. So the most unstable is the widening of the maxilla. Most unstable they have asked, और इसको ट्विस्ट करना है least stable or highly unstable, something like that. They can twist and turn the language, so just has to trouble you. Most unstable, and most stable would be the setback of maxilla. Okay, so just remember this hierarchy of stability flowchart. I have written them in the order which you should know: least stable, most stable, and all. Okay. Moving ahead, which of the following is a lingual orthodontic appliance? Incognito, sure smile, MBT, insignia, daemon. Okay, so daemon system is a passive self-ligating. MBT you know. Okay, sure smile is a customized brackets. Means they are not customized according to the patient. Okay, they have on the brackets they have built up various shapes just to please the child. Like they can be in the form of star and all that. Okay, bacha incognito or insignia. Okay, so insignia are the fully customized brackets. Okay, they are given by the Damon, or you can say Onco company, and incognito is the lingual orthodontic appliance. They are given by the company 3M. Okay, so Damon और Onco के भी lingual brackets आते हैं by the name of STB और Alias, ALIAS. Okay, so just remember the brand names and all that. Technically it's very unethical and very wrong to ask such questions based on brand names in your exams, but nevertheless we are not here to criticize the examiners. We are here to answer the question and get our selections done. Okay, so just remember incognito is a lingual orthodontic system given by the company 3M. Similarly, Damon or Onco system also have their lingual orthodontic appliance by the name STB and Alias, ALIAS. And insignia system, very important, it's a customized brackets given by the same Damon or Onco company. Okay, so the base, remember just this, that how this lingual orthodontics came into being. So in the year 1980, Onco decided to put a team together of orthodontics. This is the name of the task force to make and design this appliance. So these were the following members of this task force: Dr. Moody Alexander, Dr. Vic Alexander, Dr. John, Dr. James Hilgers. This is the same one who gave the Hilgers appliance. Dr. Cravenkers. IST 6 is this. Sorry, I didn't get your question, Bhavna. Robert Scholz and Dr. John Smith. It is, if you're asking about this is STB. Name of the bracket system. These are the lingual brackets of Onco or Damon company. One should say Onco if you're asking about the same. And just remember the name of these members of the task force because they were the original one developers of the lingual orthodontic system. Okay, and this is the insignia system. So insignia system are the fully customized brackets. Okay, so what customization does occur? So as we know from the pre-adjusted edgewise appliances that there are inbuilt tip and torque values built, and every patient was conformed according to that pre-conceived tip and torque values as given by the companies, be it the MBT system, Damon system, any system. So what does the customization do? They take a CBCT scan of the patient, and based on that they give you a prescribed, fully prescribed bracket system for each and every tooth. And using indirect bonding, these are the bonding jigs which are present. These brackets are bonded. Okay, and even the wires are fully customized. They are done through using robotic wire bending. You just have to place them and be done with it. Okay, so insignia system is the system for fully customization of the brackets tailored to the individual patients. Okay, next question. A 2-year-old child is brought to the clinic due to gaps between the teeth, with spacing observed mesial to the upper canine and distal to the lower canine. What is the appropriate course of action? Okay, again लास्ट ईयर भी स्टूडेंट्स आस्क कि सर ये इसमें तो स्पेसिंग वहाँ है यहाँ है, 2 साल का बच्चा है, अगर एंटीरियर स्पेसिंग हो, पोस्टीरियर कहीं भी स्पेसिंग हो, यू वोंट गिव एनी काइंड ऑफ रेस्टोरेशन और क्राउन्स और ऑर्थोडोंटिक नीड्स. एंटीरियर स्पेसिंग है तो फिजियोलॉजिकल स्पेसिंग होती है, कैनाइन और मोलर्स के बीच में फिर स्पेसिंग है तो प्राइमेट स्पेसिंग होती है. दैट इज़ एब्सोल्युटली नॉर्मल. सो वी जस्ट have to assure the patient that it is normal. ओके नेक्स्ट, इसी क्वेश्चन को अब हो सकता है नीट 2025 में दे मॉडिफाइड. सो इंस्टेड ऑफ गैप्स दे पुट अप दैट अ 2-year-old child is brought with crowding now in lower anterior teeth. Now there is crowding in the lower anterior teeth. Now the question is coming NEET 2025 that a 2-year-old child or a 3-year-old child or any till 5-6-year-old child with disease dentition has crowding in a lower anterior teeth. Okay, now what will we do? Start orthodontic treatment. What options? Option A start ortho. सबसे कॉमन ऑप्शन और पॉपुलर ऑप्शन है सीरियल एक्सट्रैक्शन. नेक्स्ट ऑप्शन वेट एंड वॉच. ओके लास्ट ऑप्शन क्या बोले? एक्सट्रैक्शन ऑफ डेसिडुअस टीथ. what will be the correct answer here? Again a child. Okay, so just remember that no treatment till mixed dentition. यहाँ crowding है या spacing है, you cannot do anything. Crowding है, definitely it's possible that in the permanent dentition there will be crowding based on the probability of prediction chart which I have told you. Okay, so जैसे आंसर अभी दे रहे हैं please take the same. There shouldn't be any confusion at that time. You cannot intervene or cannot do anything at this stage that will lead to any, you can say, reduction in the orthodontic treatment or fasten your treatment. Okay, the only thing, okay, supposedly यहाँ पर फिफ्थ ऑप्शन है एक्सपेंशन ऑफ आर्चेस, एक और ऑप्शन. देन व्हाट विल यू डू? क्राउडिंग है टीथ में, start orthodontic treatment with expansion of the arches. Then what will be the answer? यही सेम ऑप्शंस है, सेम क्वेश्चन है. Now option A start the orthodontic treatment with expansion of the arches. Option B remains serial extraction. C wait and watch. D extraction of deciduous teeth. या none of the above, जो भी कुछ भी बना. Okay, then also the answer remains wait and watch only. ओके वाई? बिकॉज एक्सपेंशन के लिए आपको कोई उन्होंने या तो डिस्क्रिपेंसी या कुछ भी नहीं दिया इस स्टेज पे कि क्रॉस बाइट प्रेजेंट है, कुछ है. ओके, सिंपल सा लॉजिक है. अगर सीलर एक्सट्रैक्शन ऑप्शन में है और पेशेंट एग्जामिनर चाहता है तो दे विल डेफिनेटली मेंशन यू द डिस्क्रिपेंसी इन द आर्चेस. Without mentioning the discrepancy at this stage, you cannot do anything. Expansion, serial extraction, stripping of anterior teeth, because you don't know कि क्या करने से क्या होगा या कुछ फ़ायदा होगा. See, the basic aim of testing or giving over clinical based questions like this is to test कि भाई during your internship what have you done. इंटर्नशिप में आपके पास एक ऐसा बच्चा आया, व्हाट हैव यू डन? नॉर्मल पीटो ओपीडी और ऑर्थोडोंटिक ओपीडी में अ चाइल्ड एट दिस स्टेज कैन हैज कम टू योर ओपीडी. ओके, तो डायरेक्ट उस दैट्स द एम. ट्रीटमेंट कैसे करना है एंड ऑल दैट यू विल लर्न ड्यूरिंग अ पोस्ट ग्रेजुएशन ईयर्स. ओके, सो प्लीज़ विदाउट मेंशनिंग, अगर एग्जामिनर वांट्स यू कि कुछ आप सीलर एक्सट्रैक्शन या उसकी तरफ जाए, देन दे विल मेंशन द डिस्क्रिपेंसी. जस्ट राइटिंग क्राउडिंग और some words like that doesn't mean that you have to intervene and start doing something. Okay, so at deciduous dentition stage, wait and watch. CL extraction, the child should be minimum in the mixed dentition stage, approximately between 7 to 10 years, discrepancy more than 10 mm. These things should be there. Okay, I hope I am clear. Next question, true statement about aligners is another एक previous year question जिसमें काफ़ी कुछ, अब जब ये क्वेश्चन आया था उससे आज तक काफ़ी कुछ चेंज हो गया है. ओके, थर्मो मॉडिफाइड ऑन प्लास्टर मॉडल्स, थर्मो फॉर्म्ड ऑन 3D मॉडल्स, कैड कैम और डायरेक्टली प्रिंटेड. Okay, so I would like to have a brief discussion about aligners and aligner material with you. In short, okay, so I don't think anyone would be there जिसको aligners के बारे में in the current situation और scenario नहीं पता होगा. What we don't know is the material and how are they formed. Okay, so what are aligners? Aligners are basically plastic trays. So instead of treating an orthodontic malocclusion with wires, technology has evolved and using plastic trays we are correcting the malocclusion. So like in braces, what we used to do is change the wire. In aligners we change the trays, and in each tray certain amount of movement is built in those. Okay, so how are they made? So first step in aligner making is obtaining a 3D model. How to obtain the 3D model? Using a intraocular scan. So what we obtain from an intraocular scanner is a 3-dimensional image, and from that we import a STL file. Very important word. STL stands for stereolithographic file. Now this file is input into a software, and from that we get a plan, and in that plan we get the number of aligner sets or trays which are to be made. Okay, I'm just going to write points which are important for your MCQ exam right now. Okay, so when this STL file is input, the plan is made. From that plan we manufacture the aligner using a 3D printer. So very important thing is that 3D printers only accept STL files. STL is an extension, like for Word it is .dox, for PowerPoint presentation is .ppt, for PDF is .pdf. So this STL is a extension. So 3D printers only accept an files with an extension .stl. Okay, so when we input the 3D file, the 3D printer will print the aligners. Now there are two scenarios. Traditionally I can say, not until now or today also, what is being printed by the 3D printers are the 3D models, or the models which we print, which we make using our stone plaster. Now the technology has evolved. You scan it, the 3D printer will print those models. And what are those models? On each model certain amount of tooth movement will be there, like from 1 to 14. Supposedly we have to correct a cross bite with respect to a lateral incisor. So on each 3D model there will be certain amount of movement built on those lateral incisor to push it buccally or labially. So supposedly in 14 models we reach that correct position of that lateral incisor. So the 3D printer will print those 14 models. Next step will be, once we obtain those 14 models, you will adapt a therm sheet on those 14 models to obtain that aligners. Okay, so what will be those sheets made up of? So they will be made up of this falling material. So earlier, I can say in the year 2002-2003, when this aligner technology came up in the world, traditionally we used to use these two sheets, PET-G and PET-C. PET-G stood for polyethylene terephthalate glycol. Later on, researches were done by chemical engineers and all that, and PET-C material came, having more strength and all that. And today, the material which is used in TPU या PU, thermoplastic polyurethane. which is the only material which is currently being used by all the aligner companies worldwide. Okay, certain Indian aligners company do use these cheap materials as well, PET-G and PET-C. Okay, but the most common and most popular material is thermoplastic polyurethane. So what we have are sheets made up of this material, and using a thermopress or thermoform machine like the BioStar, if you remember from the instruments images which I showed you, okay, the sheets are adapted on these models. Supposedly we have 14 models, so 14 sheets are adopted, so we get 14 sets of aligners, and that's it. So we give them to the patient has to wear these 14 sets, and the correction of the teeth is obtained. Okay, so this was the way until now which is being done. Now as the technology evolved, okay, now we have directly 3D printed aligners as well. So instead of printing those models, what 3D printers are doing now is directly printing aligners. Okay, just a minute. So instead of printing those models, what the companies are now doing is directly printing aligners. Okay, so what are these directly printed aligners? So these are shape memory aligners. Which malocclusion correction possible with aligners? Just a minute. Sorry for the interruption. I'll get back to the question, which malocclusion correction possible with aligner. Okay, so nowadays these directly 3D printed aligners are known as the shape memory aligners. Okay, so what are shape memory aligners? So if you would have studied orthodontic wire materials, we have nickel titanium. It had shape memory property. So any form it's bended, when inserted, it regains its shape to A to M conversion, and accordingly the teeth move along. So similarly, this technology or the scientists research, the chemical engineer research and incorporated this property of shape memory inside this plastic. So malocclusion kitna bhi ho, just bend it, insert, the trays are inserted and the aligners regained their shape and brought the teeth together with it. Okay, so just remember for your exam these points. Okay, so two statement of our aligners is, if they haven't mentioned any word about shape memory or something, they are thermoformed on 3D models with the correct answer. Directly printed are just shape memory aligners. Okay, so if they ask you specifically about shape memory or something is mentioned in the question, then only take 3D directly printed, otherwise thermoformed on 3D models. Okay, no company, any company they mention, okay, Directly printing is only on shape memory aligners, be it Invisalign, Strawman, Spark, something. Any company name mentioned, just take thermoformed and 3D models. We are here not to correct the examiner, we are here to get +4 marks. Okay, so no confusion what sir आपने ये बताया था वो बताया था. What I'm telling you right now, just remember that true statement about aligners or true statement about Invisalign, 3M, anything, Strawman, something, they are thermoformed on 3D models, and the material which is used is थर्मोप्लास्टिक पॉलीएथिलीन TPU और P. जेंड्यूरा नाम से शीट्स आती है, अगर आप ट्रेड नेम चाहते हो. जेंड्यूरा शीट्स वेरी पॉपुलर, जर्मन शीट्स होती है और कंपनीज वर्ल्ड वाइड बाय शीट्स फ्रॉम दिस कंपनी. ओके, डायरेक्टली 3D printed are just shape memory aligners. Okay, and coming back to the question, which malocclusion correction possible with aligners? Nowadays they are claiming any kind of malocclusion can be corrected with aligners, not skeletal ones, just dental malocclusions. Okay, just you have to select your case properly and plan it properly. Okay, so I hope I'm clear. This all points I wanted to convey to you, because aligners are very popular right now. Okay, so there are high chances question can be asked. Okay, moving ahead. कोई डाउट किसी को regarding this topic, just ask me, I'll clear it right now. Otherwise I move ahead to another controversial thing. थर्मोफॉर्मिंग किससे करते हैं? Aligner can be given in all malocclusion cases, yes, except skeletal malocclusion. I'm saying dental malocclusion can be corrected, not skeletal malocclusions. Okay, जहाँ skeletal mandible rectognathicum and all that है, that cannot be corrected. जहाँ twin block headgear देना है वो वहाँ वही चलेगा. Okay, जस्ट प्लान. अगर आप क्लिनिकल पॉइंट ऑफ व्यू से पूछ रहे हैं, जस्ट सिलेक्ट अ कंपनी जिसका वो अच्छा हो. दी शीट्स मेड अप ऑफ, जैसे आई टोल्ड यू, दे आर मेड अप ऑफ TPU या PU, थर्मोप्लास्टिक पॉलीयूरेथेन. जेंड्यूरा करके ब्रांड नेम से आती है. ओके, जर्मनी में बनती है. वांट टू नो, जर्मन मेड जेंड्यूरा ब्रांड करके आती है. स्केलेटल एंड डेंटल malocclusion डिफरेंशिएट कैसे करें यार? ये तो यू हैव टू सी द केस, यू हैव टू चेक द सेफलोग्राम एंड ऑल दैट. दैट्स व्हाट आई हैव टोल्ड यू इन डायग्नोसिस एंड ऑल. इफ यू आर आस्किंग ऑन द पोस्ट एंट्रेंस पॉइंट ऑफ व्यू, क्या स्केलेटल क्लास 2 है, क्या स्केलेटल है कि डेंटल है, दिस पार्ट ऑफ योर डायग्नोसिस एंड ऑल. आई थिंक योर क्वेश्चंस आर मोर पॉइंटिंग टुवर्ड्स क्लिनिकल सिनेरियो. So Zenduro कहाँ से purchase करें on website? Okay, so these are more clinical scenarios. I won't be able to answer. If you have these doubts, you can tag me, okay, on Facebook or something. We'll have a discussion. Okay, I'll tell you from where you can purchase them and all that. Okay, so for that you require the equipment and all as well to make these sheets and all that as well. 3D printer, scanner and all that, if you want to make in-house aligners. Okay, software as well to plan and all that. Can we give a liner? Yes, you can. Okay, now we have to move ahead because I have to discuss the questions with the students as well. Okay, so image showing a tooth movement with values of force given as 120 gram and distance at 10 m. What is the movement of couple here? So the options are again a previous year question. The answer में थोड़ा सा confusion या problem हुआ है. Okay, so the options are 12 gram, 1200, 1000, 1200 gram, anti-clockwise, clockwise and all that. Okay, अब इस image को देख के अगर हम देखें, so what kind of movement is happening here? So the movement which is occurring is uncontrolled tipping. How did I got to know that it's an uncontrolled tipping? The root is moving in opposite direction, the crown is moving in the opposite direction. Okay, so this is uncontrolled tipping. So as we know from our biomechanics that in uncontrolled tipping, MF should be greater than MC for it to occur, and MF and MC should be in opposite direction. So here, what is MF? MF is movement of the force applied. So it's applied, MF is calculated force into distance. So it is 1200, MF is 1200 gram per mm in the clockwise direction. Now the question here is about movement of couple. So for uncontrolled tipping to occur, the MC, as I've told you, should be less than MF, and that too in opposite direction. So अगर हम options में देखें, so the only option which you give is 1000. So of course that narrows our option to 2, that is B and D. And as I've told you that counter movement should be in opposite direction for that of MF. So the correct answer would be 1000 gram MF per mm in the anti-clockwise direction for uncontrolled tipping. Okay, I hope I am clear. So this is translation, uncontrolled tipping. Okay, अगर यही चीज़ translation के लिए होती, यहाँ तो uncontrolled tipping. So suppose NEET 2025 में you get a question for translation and they ask you about movement of couple in this same scenario. Okay, so MF is 1200 gram per mm in the clockwise direction. So for translation, MC should be 1200 gram per mm in the anti-clockwise direction. So what will happen? They will cancel out each other and the tooth will translate like this. This is the clear-cut, application of the concepts of biomechanics. So the counterbalancing movement should be in the outer opposite direction for the required movement to be. I hope I am clear right now. ओके, ध्यान रखना है कंट्रोल टिपिंग है, अनकंट्रोल टिपिंग है, क्या है. सम टाइम बैक समवन आस्क्ड मी दिस क्वेश्चन और वहाँ पर कुछ कंफ्यूजन या कुछ प्रॉब्लम हुई थी. दिस इज द करेक्ट आंसर एंड द कॉन्सेप्ट. ओके, मूवमेंट टू फोर्स, काउंटर बैलेंसिंग मूवमेंट किस डायरेक्शन से होगा, कितना अमाउंट में होगा. ओके, नेक्स्ट आइडेंटिफाई द इमेज ऑफ द लूप. हाँ, इमेज बेस्ड क्वेश्चन. Since we are a few days away from the exam, okay, जो एग्ज़ाम से जो 1-2 दिन पहले आई हैव रिपीटेडली टोल्ड यू द फॉलोइंग इमेजेस जो आपको जो देखनी है. फिक्स फंक्शनल में जस्ट रिमेंबर हर्ब्स अप्लायंस पक्का बताना चाहिए. ओके, एक्सपेंशन अप्लायंसेस उसमें ज़रूर एक नाइटा एक्सपेंडर देख लेना, बाकी भी देख लेना, पर नाइट जो मैंने 3-4 नाम लिख रहा हूँ जस्ट डेफिनेटली लुक करना. ओके, फंक्शनल अप्लायंसेज में तो ऑल 3 आर इम्पॉर्टेंट, बट बायोनेटर एंड लिंगुअल. ओके, these you should definitely know. Okay, next loops में ये K loop definitely. Okay, so these 1 2 3 4 5 things I mentioned about the image based question. Okay, these are definitely you should know. नहीं पता तो ये तो आज रात को ही एटलीस्ट रिमेंबर देन, रेस्ट जो दिखाएं वो तो इम्पोर्टेंट है, अप्लायंसेस एंड ऑल. Okay, so again coming back to the question, identify the loop. So it's an image of a K loop. Okay, so K loop is a molar distalizing appliance. It was given by Dr. Varun Kalra in the 1995. Okay, it is application of again a centered V bend. Okay, so what happens is centered V bend, the movements are cancelled, bodily translation occurs. It's made up of 1725 TMA wire. Okay, and this is the image of the K loop. Okay, next question. So at what age Mesiodens should be extracted? Okay, again a previous year question. Immediately as it is discovered, after 12 years, after complete root formation, after half to 2/3 of root completion of incisors. Okay, so again immediately as it is discovered on radiograph. We don't have to wait until it causes trouble or until it causes any malocclusion or something like that. As and when it is discovered or observed or seen by the dentist, either radiographically or clinically, it should be out. Okay, हो सकता है question में they mention not causing any trouble at this moment, there is no spacing, no trouble. We don't have to wait for it to cause trouble. It should be extracted as and when. Okay, which there is a clinical scenario when it can be used for stem cell research or something that things. Okay, nothing like that happens. As and when it is observed, it should be extracted because it can cause root resorption, malocclusion, anything in the future. So as and when it is seen like an impaction, it should be extracted. Next question on PNAM or presurgical nasoalveolar molding is done to passively keep the lip fragments, nasal fragments and lip segments together, lengthen the columella passively, presurgically manage the deficiencies of function or bring lip segments into contact. The correct answer is lengthen the columella passively. Okay, so it's done. Nowadays आपके एग्जाम में क्लेफ्ट और ऑर्थोग्नाथिक सर्जरी से देयर इज अ डेफिनेटली 1 से 2 क्वेश्चन आने लगे. Okay, earlier these topics were sort of ignored by when we used to teach. Now we cannot, they are more important than the traditional ones which we are teaching. So इनको ignore नहीं करना है, be it orthognathic surgery or be it cleft lip and palate, they are very very important. Okay, so their PNAM is done with the objective of positioning the cleft segments into ideal relationship before definite surgical repair can occur. Okay, and this tip extends into the columella, lifts it up so that the proper lip position and nose development can occur. And what is the biomechanical principle at this age is, as we all know, due to the presence of high hyaluronic acid level at this stage due to maternal estrogen in the child. Okay, this we have all discussed. Next, hyperactive mentalis activity, again a common type of question which students have asked me repeatedly, div 1 or div 2. So hyperactive mentalis activity is a scenario in which occurs, what happens is, due to proclined incisors there is absence of lip closure or mouth closure which occur. So what happens is, patient has to forcefully bring or close the lip so that proper lip seal can occur, and why it's necessary, so as to swallow the food. Okay, so which of the malocclusion we have? Proclined incisors, class 2, div 1. The uppers are proclined, leading to a large overjet, leading to a gap between the upper and lower lips, so the patient has to forcefully close the lips so as to achieve proper lip seal. So hyperactive mentalis is common in class 2 div 1. Okay, so these are the differentiating points between div 1 and div 2. Okay, most pathognomic feature of class 2 div 2 is deep bite. Please remember, pathognomic. Okay. Most clinically evident features is, clinical feature of class 2 would be retroclined incisors. Okay, next question. Best retainer for this orthodontically treated cases: Becks, bonded canine to canine fix, Polys with short label bow, band and sword. So looking at this image, we can see that it's a extraction case in which 4-4 extraction has occurred. Okay, so for a 4-4 extraction case, we need to give, as I've already discussed in the class, a Becks retainer. Why? So as to allow occlusion settling to occur, and at the same time prevent space from reopening. Okay, so what will happen if we bonded canine to canine fix? What will happen? The space will open up here, since it's an extraction case. Polys with short label bow. The short label bow wire will go above here. So what will happen? Again, it will prevent settling of the occlusion and leading to opening of the space. And band and spur, I don't know, it's not kind of a retainer, it's some kind of a space maintainer. Okay, so in extraction case, always go for a Becks retainer. In a non-extraction, Polys with a label bow. Okay, moving ahead. Which of the following statement is true as far as center of rotation and center of resistance of a tooth is concerned with the application of orthodontic force? Okay, center resistance is fixed while rotation varies depending on the force system. Rotation is fixed, resistance varies, both are fixed and both varies. What is the correct answer here? Okay, true and false type of question. Okay, so the correct answer is option A, that resistance is a fixed and rotation varies depending on the type of force system applied. If you want controlled, uncontrolled tipping and all that. Okay, the correct answer is option A. So this concludes our session for the day. Okay, I have discussed important topics. I have again mentioned images जो common है, definitely go through them. Soft tissue lines, definitely go through them. Okay, एक हायरार्की ऑफ स्टेबिलिटी आपका ऑर्थोग्नैथिक सर्जरी से डेफिनेटली इम्पोर्टेंट है. ओके, हाँ, हायरार्की ऑफ स्टेबिलिटी फर्स्ट, सेकेंड एंड थर्ड ऑर्डर में, बी बोथ इमेज बेस्ड एंड थ्योरेटिकल पॉइंट ऑफ व्यू. ऑर्थो में ये चार चीज़ें डेफिनेटली नहीं क्लियर है, क्लियर इट टुडे इटसेल्फ. ओके, फ्यू डेज रिमेनिंग बिफोर योर एग्ज़ाम. ओके, इम्पॉर्टेंट चीज़, अफवाहों पर ना ध्यान दें. जो नोटिस आता है वो NBA की वेबसाइट पे ऑफिशियल आ जाता है, वेदर इट्स अ डिवाइडेड एग्ज़ाम इनटू 4 पार्ट्स, 2 पार्ट्स और नो पार्ट. ओके, वो इंस्टीट्यूट ने ये कह दिया, वो कह दिया, वो इमेज देख ली, वो कह दी. Okay, believe me, किसी के पास no one has a leaked question paper or something like that. There are more mere speculations just to trouble you and divert your mind from your studies. जो इन चीज़ speculations और उनसे दूर रह के can concentrate on his study will be able to clear the exam. At the end of the day, आप ही में से कोई whoever gets good ranks will come up and I'll ask the same question कि कितनी उनकी जो speculations they were true or not. You yourself would say कि sir जो पढ़ाया गया है that was the only thing which is important. Okay, keep on solving PYQs. All are available on the app पे जो available है, जो हमारे YouTube sessions पे डिस्कस हुए हैं, various teachers, 19 subjects I think, 20-25 हज़ार MCQs तो they are available on the app itself. You have MCQ books, सब कुछ है, you have everything. Okay, again I'm requesting, don't believe on speculations and all that. Whatever you have, information comes from officially from the website. उसके लिए 2 मिनट में वेबसाइट को नहीं चेक करना, एक बार सुबह एक बार शाम, that's more than enough. व्हाट्सएप ग्रुप्स है, टेलीग्राम ग्रुप्स है, उसमें ये आ गया, उसमें वो आ गया, ये वो एंड ऑल दैट. प्लीज़ PYQ से हो जाएगा रैंक. ओनली PYQ से नहीं है. PYQ आर द एप्लीकेशन ऑफ द कॉन्सेप्ट जो आप लोगों ने पढ़े. PYQ आपको जस्ट ये बताएंगे कि किस टाइप के क्वेश्चन आ रहे हैं जो आपने थ्योरी पढ़ी है. ओके, सो जो PYQ का क्वेश्चन ना आए उसकी, या गलत हो उसकी थ्योरी जाओ पढ़ लो, दैट्स इट. वैल्यू बेस्ड है, नहीं याद रही लिख लो. पास्ट पेपर में से कितने कॉमन आने के चांसेस है, कीप इट इन माइंड, एक भी नहीं आएगा. अगर आप इस उम्मीद से पास्ट पेपर कर रहे हो कि उसमें से कोई रिपीट हो जाएगा तो कभी नहीं होगा. रीज़न बीइंग, अगर आप हर 19 सब्जेक्ट के 100 क्वेश्चन भी देखोगे तो 1900 क्वेश्चन आपने देख लिए. देयर इज़ नो चांस इन दिस वर्ल्ड कि आपको वो 1900 क्वेश्चन बिल्कुल याद रटे हुए रहे. इफ़ यू आर लुकिंग एट PYQ विद द इंटेंट कि इनमें से कोई क्वेश्चन फिर से आ जाएगा एंड मैं उस क्वेश्चन को रट लूँ, तो आपको कभी याद नहीं होगा. PYQs आर जस्ट टू टेल यू कि आपने जो थ्योरी पढ़ी है उसका एप्लीकेशन आप कितना कर सकते हैं. ठीक है, तो अगेन आई एम रिपीटिंग, PYQs या जो भी क्वेश्चन करो उसके कॉन्सेप्ट के हिसाब से करो, कॉन्सेप्ट समझने के कि वो कॉन्सेप्ट पता है नहीं पता है. Go back and read it from your notes, read it from the theory book. That's all from my side. If anyone has any doubt, कोई concept नहीं पता, कोई topic नहीं clear है, you can reach me. WhatsApp group है, Facebook group है, Messenger है, anywhere. Okay, that's all. So I'll close this session. The next teacher for you is waiting. Okay, thank you for your time.